Hi, my name is Dr. Daniel Markmann from Metamorphosis Plastic Surgery. You may have been watching our TV show for the past couple of years, which we greatly appreciate the patients who've been involved and the people out there watching.
I am the office manager here. My job as office manager is to ensure that things are running smoothly. Our patients come in for their consults, they see Dr. Markmann, then they go see the patient coordinator.
My name is Kristen Foster. I am a registered nurse and I am one of the injectors here. I'm also a laser specialist and I also perform PDO thread lifts.
I'm Sajine. I'm a physician assistant here at Metamorphosis Plastic Surgery. And so a lot of what I do, I actually assist Dr. Markmann in a lot of his surgical cases, and I see a lot of the preoperative and postoperative cases here as well. And when I'm not doing
Hi, I'm Tanika Jennings. I'm the massage therapist here for Metamorphosis. I have been a massage therapist for 6.5 years, and I love doing what I do. I love meeting new people. I love the staff.
Hi, my name is Sean. I am the marketing director here at Metamorphosis Plastic Surgery in Med Spa. I've been here for about a year now. It's an excellent place to work for. I handle all the social media.
Hi, I'm Elena and I'm an aesthetic injector here and I really like my job. I really like making patients feel good about themselves on the inside and out. And I've been working here for about 10 months.
My name is Holly. I am Dr. Markmann's or one of Dr. Markmann's patient coordinators. I help patients get through the surgical process. If they have any questions, I answer all their questions.
Hi, I'm Wengo Guksa. I am a receptionist here at Metamorphosis. I think that, I'm one of the first people that people see when they first come in. It's great to greet people and, to welcome them.
What is a mommy makeover? This surgery combines multiple procedures including fat removal, skin lifting, and tightening for the breasts and abdomen using techniques designed to correct the physical effects of childbearing. Candidates for this surgery are women who cannot achieve their pre-pregnancy physique with diet and exercise alone. Simply put, they are not able to fix certain body parts on their own. This procedure is tailored for each patient, but commonly involves the breasts, abdomen, and often the vaginal region.
So I'm Dr. Daniel Markmann, board certified plastic surgeon here at Metamorphosis Plastic Surgery. So we're announcing our new association with Dr. Sanjay Jose, who is a periodontist and implant surgeon. He has the most high-tech office equipment, a robot called Yomi, all of the best equipment possible for dentistry. We've been affiliated with him for a couple weeks now. He does amazing work. So we're definitely proud to have him as part of our team. So not only does Dr. Jose have the most high-tech equipment in Maryland, but also his philosophy is to have pain-free dentistry. So his office is set up not only with this high-tech equipment, but also with extreme comfort settings as well. You can alter the ambience in the room, the lighting, the curtains, the shades, whatever, just to make sure you're comfortable. For years, I've seen patients here in my practice for body contouring, facial rejuvenation, and I've noticed many of them don't have the greatest dentition. Some people don't know what to do or what they can do. So we now have affiliation with Dr. Jose so that he can take care of these problems for our patients as well. So if you have an issue with your teeth, missing teeth, broken teeth, give us a call here at the office and we will set you up with Dr. Jose.
My name is Shelly. I lost over 100 and some pounds. and I need to get some extra skin and some fat removed to get my body back into the same condition it was before I had gained weight, and that was due to having a child. I was 300 pounds, and I exercised, I started eating right. It was a journey, mentally, physically, that was a lot. I went and saw like a therapist as well to try to get through that, and a nutritionist. So yeah, and it's just an extra step, an extra push, which is a positive to go get your goal that you want. When you have more people that are surrounding you, to pushing you in all positive directions, you get that done. You know, I'm a pretty confident person. I know other people that it's really taken a toll on them before they could get surgery done. But you know, I'm just glad I'm here in this moment and it's all getting ready to start. I thought about it for 10 years. Yeah, and I went to different doctors and I was like, I'm not gonna get it done. Should I get it done? Is it gonna be worth it? But in the long haul, you have to make sure that you are happy to make other people happy. So it's definitely a work in progress on yourself. But do it for you, nobody else.
Today we're gonna do a little surgery on Shelly. So Shelly's here today for some removal of some fat from her upper back area. She has some other things we're gonna do a little later in the year, actually early next year I think it is. So we're going to do some skin tightening next year. So she's lost a lot of weight, got a little extra fat remaining, and then once all that's gone, we're going to go back to the operating room and take out some skin. Do a little skin tightening of her upper back. We're taking out some fat today, and then in January, we're going to take her to the operating room and do a little bigger procedure. It's called an upper body lift. Upper body lift is basically a scar along your bra strap. It starts in the front on each side, goes all the way across around your back, and we pull all of that loose skin back up where it came from and remove all the excess. So today we're going to remove some fat, get ready for that procedure in the winter time, and this will be a quick, easy procedure. So do you have any questions for anything today?
No, I do not. I can't wait to get started. Okay. This is the first step in the procedure and I'm so thrilled.
It'll be good.
Yes.
You're going to like it. So,
yeah.
Okay, so we're going to go get started. Alright, so we just finished surgery on Shelly. So we did a little bit of liposuction in her upper back. We do with people awake but sedated a little bit. She's at the end of it said it wasn't a big deal. She did beautifully. So we took off about 1 liter of fat, which is a good bit for somebody awake in the office. Looks nice and smooth, nice and even. She's at this point says she has no pain, so she did beautifully, and we'll see her back next week to check everything out again.
So hi, I'm Gina Reeves, and I'm a patient of Metamorphosis with Dr. Markmann. So yes, I'm getting a thigh lift today. I lost a lot of weight and my thighs are horrible, so I need to have this done. Yeah, so the thing is, I just don't like the way my thighs look, the extra skin and the fat, so I need to have this straightened out, so I don't like that. Well, yeah, it's been an easy process. I came in for my consultation. We had a good consultation, a good talk. He walked me through everything, what I was going to, be dealing with. So I decided, it took me a little bit of time to make up my mind, because initially I was going to get an arm lift as well, but I decided to just go with the thigh lift at this time and see how that works out for me. And then if everything is good, then I will come back again for the arm lift. It's been a couple of years. Initially, my initial weight loss was back in 2003. And so then I gained some weight back, lost some weight, and this year, I don't know really what it was, but I just don't like the way my thighs look, and I just decided this is it. No, just personal satisfaction, that's it. No, there is no story. Like I said, honestly, I just look at my thighs in the mirror and I do not like them and I want to get it done. So it's not about wearing short shorts, it's not about wearing a bathing suit, it's just I don't like it. She said it should be about 6 weeks, and so I'm looking forward to that because I get some time off, and I get some mental health recovery as well. Honestly, it's just when I look in the mirror, as long as I'm satisfied when I look in the mirror, that's it. I don't think I'm going to do more, do less, or anything like that. So like I said, it's just for me. Oh, I think Dr. Markmann's great. Like I said, I just had the consultation and, he was fine. He was excellent. I actually had a referral to Dr. Markmann back in early 2000 when I was going to initially get it done, but I never got it done. So yeah, coming to him I think was a very good choice.
Hi, my name is Arletis Michelle, and I am here to get a BBL, Brazilian butt lift. I decided to get this procedure because I had a kid, and I have kind of like a mommy pouch, and I kind of want to get rid of that, and I also want to increase my buttocks. I want to make it a little bigger, and yeah, that's all. This procedure is just for personal satisfaction, just to be happier with myself and feel more confident. I started thinking about this process this year. It was never in my mind. I usually work out a lot, but I don't get the results that I'm looking for, so I decided to go with the surgery. My boyfriend actually came here for another surgery, and I saw the results that he had, and it looked really good. So I'm like, I think I'm gonna look more into Dr. Markmann and see his work on other stuff. And I saw the results for other girls when it came to Brazilian butt lifts, and I really liked it. So that's why I decided to go with him. Yeah, my consultation, we did it through Skype. He was very nice. It made me feel very comfortable. I'm usually very shy on the camera, very shy speaking on the phone, and he made me feel super comfortable. He was very detailed on explaining the procedure. He told me the results that I was gonna get. He was very realistic. He said that his results are usually very natural looking, and that's exactly what I'm going for. I'm not going for anything too crazy, too dramatic.
My name is Kara Dunn, and I am here to see Dr. Markmann for a breast lift and augmentation. So I actually have wanted to get my breasts done since high school. I've always had volume, but it's never been what I wanted. I had 3 kids, so I'm married and have 3 kids. I have a 3-year-old, a 2-year-old, and a 6-month-old, and breastfed all of them. And now definitely lack that volume and just really want my perfect breasts and just look amazing and feel confident, and so I'm back. Definitely is a knock to the confidence. So I've always been kind of confident, but when I'm needing to wear something that doesn't require a bra, I'm always taping myself up. So the girls are where they should be, and especially now, like I said, they've gotten even more deflated than when I was in high school and college, and I kind of avoid those situations at all cost. So I'm just looking to kind of elevate my confidence even more. So I'm a boudoir photographer, and I definitely preach confidence, and I am very confident in my body. However, I am very well aware that there are things that I want to change and make even better, so that way when I do walk into a room, I'm not worried about like where my breasts are sitting or how I look in a shirt or in a dress. So I, again, just really look to elevate my confidence and really have like nothing that I'm self-conscious on. Oh my gosh, I'm absolutely just gonna be rocking. I have so many things in my closet that I'm so excited to wear because I can't wear them with like my nursing bras. That's just not a cute look. So I'm really excited to actually put on, you know, some of my like bodysuits and stuff and just be able to go braless and just feel and look amazing. It's all just like the cherry on top. That's what I was telling Dr. Markmann was, I have confidence now, but I definitely look forward to having like even more confidence and just not worrying about my appearance at all.
So next we're gonna go see Kara. Kara is here for breast implants and a breast lift. So a lot of women over the years with weight gain, weight loss, having children, getting pregnant, getting engorged with milk, their breasts get stretched out, wind up being a little droopy afterwards. So in Kara's case, we're gonna do a lift and we're gonna put in some implants. We actually have a machine called Vectra. Vectra is a 3D imaging system where it takes pictures of your body from all different angles. The computer puts them back together into one 3D image. When the computer, it'll take measurements of her breast, tell us which one's bigger. It will do a breast lift of whichever variety we need. There's several different types of breast lifts. And then it'll also put implants in her breasts. So she can choose what size she wants. We can show her implants anywhere from 200 cc's up to 700 cc's, and she can see several different options, and she gets to pick what she wants. So it's kind of a fun way for women to choose how big their breasts are gonna be. In the old days, we would tell them this is the size that's best for you. Now the patients get to choose by using Vectra.
Yep.
Good morning. How are you?
Good, how are you?
I'm doing well. Getting ready for your big day?
Yes.
Yes?
Really excited.
Fun and excited?
Yes.
A little nervous?
Honestly, no, I'm really excited.
Awesome.
Yeah.
So we're going to do a breast lift, and we're doing breast implants,
Yes,
correct? So whatever you see on the computer as far as size is pretty much exactly what you're going to get. So we'll show you numerous different sizes. You pick and choose what you like.
Cool.
It'll even put a bra or bikini on for you, so you can see yourself in a bikini. And that way you get to see what it's really going to look like.
Cool.
Okay?
Awesome.
And hold real still until after the flash. All right, that's it.
And then this will give me a good idea of the outcome.
Yes. So what you see on here, and there's different types of lifts. They're a little different. So we try to show you on here what the lift is going to look like. But the implant size is 99.6% accurate.
There we go.
Awesome.
Cool.
So that's just a lift.
Yeah.
600, 700 cc's.
I was thinking like 700-ish.
Okay.
I really want the volume back, so I don't have volume like at all. Right. So I don't want it to be noticeable that I have implants, but I want, like, my goal is to not have to wear a bra and to still look good.
That's right. So Kara is actually here today as a patient. We're going to do breast lift and implants. She's also partnering with us for our practice. So Kara does boudoir photos.
Yes.
That's what you call it?
Mm-hmm.
Okay. So we are doing a little partnership with Kara that our patients who have their surgeries done and who want to get some before photos as well as some after photos. So we want to get before photos just as you were before. And then afterwards you do a boudoir shoot with her.
So I am a luxury boudoir photographer, and basically what that means is I take care of my clients from start to finish. So you would book in with me and we book you with professional hair and makeup. We have all of the lingerie in our studio, so we carry sizes extra small through 5X. And that way you can essentially roll out of bed and leave with amazing photos. So my whole premise is I want you, even if you don't necessarily think you have the confidence now, after you have surgery with Dr. Markmann, you step into the studio, you leave feeling amazing, looking amazing. My turnaround is really, really quick, so even the same day you leave with an image from your session, again, just to kind of like play up on that high and just really make you feel awesome and kind of be the cherry on top of doing surgery here.
And I've seen her photos. We've had a couple of our employees do it already, and they're absolutely gorgeous. So very classy, very well done, and absolutely beautiful.
Awesome, thank you.
She does great work.
Thank you. Thank you so much, Dr. Markmann. I had a great time talking to you. I think you eased. I didn't really have too many nerves coming in because I kind of knew what to expect with you in the practice, but I just feel that much more like light and at ease with everything, and I'm really confident that we're going to get exactly what I'm looking for. I honestly just really love how welcoming you are. Coming in as a patient, it's sometimes very nerve-wracking where if I didn't know you ahead of time, I'd be like, oh my gosh, I love you don't push anything on your patients. So even when I'm talking to clients of mine that are interested in anything, I always say he's great. He's not gonna like make you want to do something or push you out of your comfort zone. You kind of just go along with the social cues that I kind of am giving you, and you're like, okay, I think that would be great. What about this? But you don't push anything, so it's not an uncomfortable experience. And even with you being a male plastic surgeon, again, a lot of women I think would be self-conscious, but for me, I got none of that, and it's just really nice, and the whole team is very welcoming, and I like feeling comfortable and like I'm coming into like friends and family versus it's a doctor in his practice. Thank you.
You are very welcome. Glad you're happy so far, and you're going to love the results when it's done.
Oh, I'm so excited. So excited.
Very good.
Metamorphosis Plastic Surgery and Med Spa would like to present to you their 12 Days of Christmas special. Starting December 7th, each day they will be unveiling a new package or special for all of their beloved clients. Let's watch the Metamorphosis team as they prepare for the upcoming event. Already missed the first couple of days? Don't worry, there's still more days to come. Be sure to check in with Metamorphosis Plastic Surgery and Med Spa's Facebook and other social media sites to stay up to date.
A woman who's been married for 30, 35 years. She's raised 2, 3, 4, 5 children. And then one day her husband comes home and says, honey, I'm sorry, we're getting divorced. I found a younger version of you. So it's very devastating to a lot of women at that point. A lot of times the husband's been the moneymaker for the relationship, for the family, and she's left alone. And looking to start over again is kind of a tough thing for them as well. The plans for the VIP Plus is to make the overall makeover a pleasant experience. Again, helping them along with whatever their major concerns are, either physically, emotionally, psychologically, getting back in physical shape, which is going to be beneficial for their health as well. Just give them a whole new start on life, just feeling better, looking better, and giving them their confidence again. You get them psychologists, nutritionist, personal trainer, a life coach, a personal shopper, and then eventually when they're feeling ready, get them back in the dating scene with a one-on-one date for lunch. So in my practice, we see a lot of women come in who have had children, and it definitely takes a major toll on their body. So we do a lot for helping them physically to get back to the body they used to have. Many women who have gotten divorced, they can be married for 30, 35 years, had several children, and then all of a sudden their husband leaves them. They're kind of left empty, depressed. And what we want to do is kind of make them feel better, look better, and give them a second chance to start over again. So these women have devoted the first half of their life to raising children and taking care of their husband. So this is their turn to start their second half of their life. It's all about them at this point. We want to make this a more happier life for them, more fulfilled, reach their dreams, and definitely improve their self-esteem. So Metamorphosis VIP Plus is a program we're starting here in Maryland. We do draw for patients all across the country, so we're hoping eventually to syndicate this across the country. Have other doctors get involved and just have it spread and help all these women who definitely are feeling a little down and depressed. So this is a luxury package to get you a new start on life. So please call us for a free consultation. We'll give you all the details and tell you how to go about getting started. So if you're a mother out there who's raised a few children or a woman who's recently got divorced, you got to tune into our show. This can really majorly change your life.
Watch our show each week to hear the stories of people who were lost later in life, found, and went through a metamorphosis with VIP Plus.